Warm up.
You can warm up.
Hi Tara. Hello. I'm Samantha. I'm going to be your student nurse today. Before I came in here, I checked your chart. We're going to perform a physical assessment. I went ahead and gathered all of my supplies. I'm going to go ahead and wash my hands. How are you doing today?
Just don't sit there and like, if I don't, I'm going to be laid up in the bed.
Alright, yeah, I'm going to provide some Tylenol for her.
Warm up first, then stretch, then work out. That works too.
So, how are you feeling?
I
feel good. Have you had any fevers lately?
Yeah.
No. Okay, go ahead and check your temperature.
Yeah.
Because your body's not, your muscles
My
aren't
back
warmed
gonna
up.
snap if I don't stretch. Yeah.
Alright, 98.9.
Yeah, those are the ones that I do in the morning. Things like that.
I have weights in the house. I do
You don't,
actually, but.
for these ones that I'm gonna send you, don't need any weights. That's all mine.
Burpees? I can do burpees without a weight.
You can do burpees without a weight.
Awkwardly, very awkwardly.
Alright, and I'm gonna go ahead and put this on your finger.
All reminders doing it
I'm
on
gonna go ahead and take your blood
You're
pressure.
thinking when you like take it, you go.
Oh no, that's a power.
I get those like.
I'm gonna feel to make sure her brachial nerve or brachial artery is right there. And then I've already taken her blood pressure before, so I know where to put that up to.
Yes.
Okay, so Saturday night.
We're going through the cranial nerves real quick before I continue. Cranial nerve number 1 is olfactory, which is smell. Optic is vision. Motor and trochlear, which are great for eye movements. The trigeminal.
It was 112/72, so that's within the limit.
Nuisance is lateral line.
And her pulse is 94, and her O2 is 90. Wait,
Vagus is.
her O2 is 98, sorry.
The accessory is shoulder movement.
And then I'm gonna go ahead and double check her pulse
movement is the
manually
last one, hypoglossal.
with her radial artery.
Yeah. Yeah, I think I said that right. So I'm gonna continue with respiratory.
Okay. Okay, and I got 90 again, and her respirations are 14. Alright, do you want to go ahead and follow me over to the scale? Nope. Pause it. There's people there. Go ahead and step on for me. Your belly. There we go. I'm gonna have you bend over. You're about 110, and then can you go ahead and turn around so I can go ahead and check your height? You can step back up. And you are 5'3". Alright, let's go ahead back in.
Okay, I want to ask you about your
Have you ever smoked?
Yes.
anything that might affect healthcare.
Okay, and we're gonna go ahead and start her heat exam. Can you go ahead and take your hair down for me?
I'm a part of the spirit. You're supposed to be the same.
I'm gonna put gloves on while I inspect her scalp. And I'm gonna be looking for head symmetry, any lumps, bumps, abrasions, infestations, bruises. Her hair distribution is even. Okay, you can go ahead and put it back up now. And then I'll take them off and wash my hands. Okay. And while we went over there, I checked her neurological status. She can see, she can walk. Do you know who I am?
Here's Samantha.
Okay. Where are you?
Giovanna.
And do you know what day of the week it is?
Wednesday.
Wednesday. Okay, so she's alert and oriented. To person, place, and time. She's in a pleasant mood. She's cooperative and she has a good effect. Her speech and communication is clear, meaning that cranial nerve 5, 7, 10, and 12 are intact and working. Can you go ahead and grab my fingers? And then can you push against? And then pull back. Alright, and go ahead and push up. And then push down. Push up. And then push down. Okay.
Get your annual mammogram.
So there was no indications for a Glasgow Coma scale or a mini mental exam, and her grips were equal bilaterally, and her plantar flexion was also equal bilaterally. Okay, so I'm gonna go ahead and move on to your eye. Do you have any eye pain?
No.
Do you wear glasses or contacts?
No.
When was your last eye exam?
Last week.
Okay. Her eye, her outer canthus is positioned appropriately with her ear. And she had her eye exam last week, and it was, her visual acuity is intact, and she can see even that her ocular or optic nerve is working.
Nope.
I'm going to go ahead and look at her pupils.
Good.
Okay. Go ahead and look straight at me. Okay, they're equally round reactive to light and accommodation, and they're about 3 millimeters. So her ocular motor nerve is working. All right, go ahead and look straight at me.
You had intentional weight loss?
Yes.
Okay, I'm visualizing her ocular fundus, and it is appropriately
Between then and now.
pink and intact.
Can you listen to the bowel sounds for 1 minute?
Can you go ahead
Each one.
and follow my fingers, okay?
Right lower. Right upper. Left upper. Left
Okay,
lower.
and then follow on it.
You have.
Very good. How many
listen
fingers do you
for
have?
4 minutes.
2.
Each.
2.
Can you palpate like 2?
Okay, very good. I tested her cranial
And then
nerves
you go into deep palpation.
3, 4, and 5.
Superficial masses.
3, 4, and 6. And they're all working. There was no lid lag of ptosis and no nystagmus.
Another one.
Okay, now onto your ear. I'm gonna go ahead and inspect it. Oh, and with her eyes, when I looked at her ocular fundus and all that, I visualized her conjunctiva and sclera, and they were both clear.
Any other thing?
I'm checking for any bumps, bruises, abrasions, any pain. Did you feel any pain when I touched your ears? Okay. I'm going to go ahead
Alright, and then you go
and
to
visualize the tympanic membrane.
the bladder, straighten out, palpable. And person really has to go to the bathroom and then pull the descended. How's your urinary? It's good.
And it is clear, there's no redness or swelling. Do you have any ear pain?
No.
Clear.
Okay. There was no wax buildup or any of that.
Cloudiness, any blood in it?
Okay, I'm gonna go ahead and whisper in your ear and then just repeat to me back what I say.
Yes, any cloudiness.
Puppy.
No, it's not.
Is it like warm?
Back
brown?
Warm and brown.
Okay. So she had a positive whisper test, and so her acoustic cranial nerve is intact and working. I'm gonna move on to the nose.
Can we start with the neck? Bring your chin.
I'm so sorry. You can just cut this part out.
I'm gonna inspect it. Do you have any nose pain?
No.
History of congestion?
Bring your ear.
Trouble breathing through your nose?
No.
Okay, I'm gonna go ahead and look at it.
Your arms, can you raise
And it
them
is
up?
pink, her septum is intact. Can you go ahead and go with this? And then do this on the other side. Very good. No congestion present right now. Her nose is symmetric. Can you go ahead and smell this? What
Smells like vanilla.
Okay, close your eyes. What does it smell like?
Lemon.
Okay, very good. And then I'm gonna go ahead and palpate your sinuses. Tell me if there's any pain. This is the frontal sinuses.
No pain.
Okay, and this is her maxillary sinuses. And this is her ethmoid sinuses.
No
Any
pain.
pain? No. Okay, good. And then I'm going to move on to your mouth. I'm going to inspect her lips first. Her color is pink. They're moisturized. No cracks or ulcers. Go ahead and open your mouth. Okay, I'm going to look in. Her oral membranes are pink. Her teeth are white. Can you lift up your tongue for me? Very good. Her tongue is intact. There's no sign of atrophy. And by being able to open her mouth and lift up her tongue and all that, it shows that her cranial nerves are working, her 9 and 10. Can you go ahead and swallow for me? Very good. Her trachea is aligned. Can you do it again? All right, and I can feel the rings all along it. I'm going to go ahead and back. I'm going to palpate her thyroid. And there's no swelling or anything. And then I'm going to go ahead and palpate her lymph nodes. I'm going to start with the preauricular, go back to the postauricular, and then to her occipital. I'm going to come back, submandibular, submental, and then her tonsillary, and then superficial cervical, deep cervical, posterior cervical, and supraclavicular. And then we can cut.
Oh.
I think that's all fitting here. Okay, now moving on to the assessment of your skin. I'm going to go ahead and just visualize it. I'm going to look at her overall appearance. It's even, her skin is moist, and it is appropriately warm throughout. I'm going to go ahead and look for any lumps, bumps, lesions, bruises, abrasions, contusions, which she has none of. And I'm going to go ahead and check her skin turner. I'm going to pinch her skin on her hand, and there was no tenting visualized, and it went back in less than 3 seconds. There was no vascularity visible. I'm going to go ahead and check her nails. There's no clubbing. I'm going to check her capillary refill while I'm here. And it is less than 3 seconds, inappropriate. I'm going to go ahead and check in her axilla. I'm going to see if there's any indications for a breast exam needed. Can you go ahead and lift up your arm for me? Okay. And it looks great. There's no lumps, bumps, bruises, abrasions, anything in there. That indicates for a breast exam. Do you take a shower or a bath?
I take a shower.
Okay, and how often do you shower?
At least every day.
At least every day. Do you use soap and warm water?
Yes.
And you scrub decently?
Yes.
Okay, great. Moving on to her respiratory and cardiac assessment. I'm going to go ahead and we already checked her oxygen saturation when I did her vital signs. Do you smoke?
No.
Were you ever a smoker?
No.
Are you around secondhand smoke?
No.
Do you have trouble breathing?
No.
Okay, so her breathing is fine. As she's sitting there, I'm inspecting her breathing pattern and her chest symmetry, noting that she has an even symmetrical breathing pattern. Do you have a cough?
No.
Okay. And I'm going to start in the back, and I am going to check her chest excursion. Can you go ahead and breathe in for me deeper? Okay, and it's about 5 centimeters, which is appropriate. Can you go ahead and say 99?
99.
Say 99.
99.
Say it again.
99.
Okay. I went ahead and felt for tactile fremitus. The vibrations were felt throughout and are appropriate. I'm going to go ahead and auscultate. Okay.
She does everything independently.
Can you take a breath in?
The genital urinary navigate is preferred for students. However, if you could lay down for me, I should just be able to.
And I'm doing this under her shirt. And again.
Feel
Again.
It changes the bone, which is not
I checked all the lobes of her lungs, and no adventitious lung sounds were heard. Go ahead and say 99.
99.
Go ahead and say 99.
99.
Again.
99. 99.
Again.
99.
And again.
99.
Great. And I went ahead and listened to her for tactile fremitus, and it was muffled, which is appropriate. I'm going to go ahead and percuss.
Yes. Okay. Can you do that? That one's the one? Yeah. Okay. Okay. So no indication for a breast exam at this point.
Okay. And resonance was heard throughout with percussion. Now I'm going to go ahead and move on to the front. I am going to listen. I'm going to start up here with her trachea. Okay. And then I'm going to start listening to her bronchial. Bronchiovesicular lung sounds. Go ahead.
Making sure that she's in a safe environment. And I'm also going to be documenting her manuscript. Thank you. How long was that?
I'm listening to your
Very long.
I've been scared. We started, I think we spent at least 15 minutes on that last one.
Okay, and no adventitious lung sounds were heard.
That last half.
I'm going to go ahead and percuss.
You're supposed to.
I know, I thought this was
Okay, and resonance was heard throughout.
I don't know why it cut off.
And no adventitious lung sounds were heard. Okay, I'm gonna go ahead and move on to her cardiac. I'm going to begin by listening to her heart sounds. I'm gonna start at the second intercostal space on the left sternal border, right sternal border. Alright, and then I'm gonna go ahead and move over to the second intercostal space on the left sternal border.
Way more than me and I did.
And then moving down to the intercostal space on the left sternal border.
Yeah. And you explained so much more than intercostal space means you're going to
Left sternal border.
Okay.
And then I'm moving on to the fifth intercostal space in the mid-clavicular line.
No, I didn't find it. I was like, there's no
Okay.
rapid oscillation.
And S1 and S2 were audible and no extra heart sounds were heard.
I still think you did very
I'm
well.
going to listen for cardiac bruits.
Yeah, I
You were
don't think you
awesome.
missed anything.
You were awesome.
No, yeah. You
You
didn't miss.
too much.
Huh?
And while we're there, you get like
Nothing was heard. Then I'm going to go ahead and move on to feeling her pulses. I'm going to start with her temporal.
I'm just kidding.
And then I'm going to move on to her carotid one at a time.
Yeah. I only went over by 4 minutes.
Okay. And then I'm going to go ahead and feel
And a lot of
That's
us,
4 minutes, exactly.
yeah,
her
I'm gonna
brachial.
trim it down for the parts that were less trained.
Yeah.
Yeah, 30.
Very good.
Yeah.
Her radial.
Honestly,
Her ulnar.
Like 2 minutes over.
Her radial. And her ulnar. Okay, can you go ahead and lay down for me and take off your pants?
Oh, that was for the summer.
No, I'm worried about the video. We will get to the timing for the check off.
I thought it was
I'm
the same
feeling
thing.
for her femoral.
We only have to follow this.
Very good. And then I'm going to go ahead and feel for her
You
popliteal.
your paper, I was like, just look over there.
Okay.
I can't read that, girl.
Oh.
Her other
You need
popliteal.
glasses. When was the last time you had a diaphragm?
I'm going to go ahead and move on to her posterior tibial.
It was my fault. I wrote it up.
Her other posterior tibial. And then I'm going to move on to her dorsalis pedis. And then I'm going to move on to her other dorsalis pedis. Okay. You can go ahead and sit up now. Okay. So I'm going to go ahead and I'm going to check for any edema, and no edema or swelling is present. I already checked for her capillary refill, and then her temperature is even and consistent and warm throughout the body. Okay, moving on to the gastrointestinal. I'm going to start by interviewing her. Do you have any issues with chewing or swallowing?
No.
Do you have any indigestion?
No.
Have you had any recent change in your diet, fluid intake, change in appetite, weight gain, or weight loss?
No.
No? Okay, great. Do you ever have any diarrhea or constipation?
No.
When was your last bowel visit?
This morning.
Okay. And then I'm going to go ahead and ask her to lie down. Can you lie down for me? Okay, great. And then can you lift your shirt up for me? I'm going to begin by inspecting her stomach underneath for any lumps, bumps, bruises, anything like that, and masses. And everything looks good. And then I'm going to move on to auscultate. I'm going to start in the lower right quadrant. I'm going to listen for about a minute and listen for 4 to 20 gurgles, and they are active. I'm going to move up to the upper right quadrant, and I'm going to do the same there, as well as in the upper left quadrant, and then the lower left quadrant lastly. And then I am going to
None of us will be addressed.
percuss her stomach. And this is for dullness and tinnitus. Alright, and dullness and timpani were heard in the appropriate places. And then I am going to go ahead and I'm going to palpate your stomach. Tell me if you feel any pain or tenderness, okay?
All right. And if there's nothing else I can do, I'm going to.
No? Everything feels good? Okay, you can go ahead and put your shirt back down. There was no masses or anything there. Then I'm going to move on to her musculoskeletal. Do you have any history of falls?
No.
Okay, great. When she walked over to the scale, I assessed her posture, gait and stance and swing. It was appropriate, strong, steady, upright. Let's go ahead and we'll look at your range of motion. Can you just repeat, follow my steps? Okay?
That was hilarious.
Okay. Put your hands up like this. Okay. And then I was able to assess her hips as she got on and off of the table. She has full range of motion in her hips. You want to go ahead and lay down so we can look at your feet and knees? Was this from here? Yeah. Okay. Now, can you bend your knee for me? Great. And then can you go ahead and flex your feet? And then point them. And then can you move them outward, inward, and then can you move them like that? Very good. So she has active range of motion in all of her extremities. You can go ahead and stand up for me. Can you bend over? I'm going to go ahead and assess her spine for any curvature. And it is appropriately curvature. Can you go ahead and stand on one foot for me? Okay, go ahead and stand on the other. And her balance is also appropriate. I was able to assess her muscle tone and strength earlier when we did the grips and plantar flexion, and it was at 4+. Okay, and then I'm going to move on to her reflexes. I'm going to start with her biceps. Okay, and then I'm going to move on to her triceps. And then I'm going to move on to her supinator. And then I'm going to go ahead and do that on the other arm. I'm going to start with her biceps. To her triceps. And then her supinator. Alright, I'm going to go ahead and move on to her knees. And then I'm going to move on to her ankle. Very good. Okay. So then for her sensations, I'm going to go ahead and ask her, can you close your eyes? Can you tell me if it's dull or sharp? Dull. Dull or sharp? Dull. Okay. And then dull or sharp? Sharp. Dull or sharp? Sharp. Okay. And then I would also test for coldness. Can you tell me if it's cool or hot? Cool. Cool or hot? Cool. Okay, very good. And then how do you get around at your house? Are you able to get dressed, shower, do all that on your own?
I can do it all by myself.
Okay, are you able to cook, clean, do everything that you need? Mm-hmm. Okay, so all of her activities of daily living are performed independently. Moving on to the genitourinary. About how many times a day do you urinate?
4 to 6.
4 to 6. Okay. And would you say it's about an appropriate amount?
Yeah.
And how would you describe your urine?
Like clear to like a light yellow, depending on how much water I drink.
Okay. And do you ever have any bladder pain?
No.
Frequent UTIs?
No.
Any blood in your urine?
No.
Any issues with your urine?
No.
That you would say? Okay. And then I would go ahead and move on, and I would tell her about self-breast examinations, or I would give her one if one seemed that it needs to be done. But in this case, it does not. And then we'd go ahead and move on to her psychosocial. Let me know when. What am I gonna say? Who do you live with?
My family, my husband, and my kids.
Okay. And do you feel that you have a good support system?
Yeah, I have a lot of friends.
Okay, great. And so she is in the stage of intimacy versus isolation, and she is appropriate for her age. For culture and spiritual, do you have any religious beliefs or anything that I need to be aware of in order to give you care?
No.
No? Okay, great. And then I'm going to move on to patient education. Should she have said that she smoked, had shortness of breath, I would provide education. I would provide education about self-breast exams, and any other topics that were indicated, but none were indicated today. And then for concluding actions, I would leave her in a safe and comfortable spot. If you want to go ahead and lay down for me, if that's comfortable for you. If she was in a hospital, I would go ahead and raise both side rails. I would make sure the bed is in its lowest position, and I would give her the call light. Can I get you anything?
No, I'm okay, thank you.
Okay. Then I will go ahead and wash my hands, and then I would document. Okay.
Oh, yeah.